सर की अनुमति से कार्यक्रम को मैं आगे बढ़ाने की अनुमति चाहूँगा। हमारे बीच में आज इस नस्या आयुर्वाणी के 11वें संस्करण में सभी का स्वागत है। आज के मुख्य अतिथि के रूप में माननीय श्री सुरेंद्र राय सर, जो डायरेक्टर जनरल आयुष बिहार सरकार हैं, और आज मुख्य वक्ता के रूप में हमारे बीच में डॉक्टर महेश सर जुड़े हुए हैं, जो एक नामी डर्मेटोलॉजिस्ट हैं। सर्वप्रथम मैं कार्यक्रम को आगे बढ़ाते हुए सर्वप्रथम वैद्य जागृति से आग्रह करूंगा कि वो भगवान धन्वंतरी की वंदना कर इस कार्यक्रम को आगे बढ़ाएं। वैद्य जागृति।
धन्यवाद सर। सभी गुरुजनों को मेरा प्रणाम। वैद्य जागृति कुमारी, पीजी स्कॉलर अगतम, गवर्नमेंट आयुर्वेद कॉलेज पटना, आज के आयुर्वाणी प्रोग्राम में धन्वंतरी वंदना प्रस्तुत कर रही हूँ। नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुकभयमृत्युनाशं धातारिमेषं विविधौषधीनां चव्यों वातावनिवारिवनि पंच प्रपंचात्मकदेहभाजं संताप संपात जरजरन्तकं नमामि धन्वन्तरिमादिदेवं नवीननीलामुदकान्तिकान्तं कान्तं हरर्द्वादश आख्यमूर्तिं पूर्तिसतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवं नमामि धन्वन्तरिमादिदेवं नमामि धन्वन्तरिमादिदेवं।
धन्यवाद। अब मैं आज के मुख्य अतिथि श्री सुरेंद्र राय सर, जो डायरेक्टर जनरल आयुष विभाग बिहार सरकार के पद पर अभी यहाँ कार्यरत हैं, और बहुत ही सौम्य स्वभाव के, हमें जब भी उनकी मार्गदर्शन की आवश्यकता होती है वो हमेशा तैयार रहते हैं। तो ऐसे व्यक्तित्व आज हमारे मुख्य अतिथि के रूप में है। साथ ही साथ आज हमारे मुख्य वक्ता के रूप में डॉक्टर महेश पी सवलिंगमथ सर हैं। बहुत ही अभी यंग आयुर्वेदिक फिजिशियन हैं, और अभी वो प्रोफेसर के रूप में डिपार्टमेंट ऑफ अगत तंत्र बेलगामी में आयुर्वेद कॉलेज श्री BM कनकवाड़ी आयुर्वेद कॉलेज, उसमें एज ए प्रोफेसर कार्य कर रहे हैं, पदस्थ हैं। और इनका एक आयुर्वेदिक डर्मेटोलॉजिस्ट के रूप में ख्याति मिली हुई है, और ये डर्मेटोलॉजी में एक स्पेशल कार्य कर रहे हैं अगध की विधा से और आयुर्वेद की विधा से। ये आयुर्वेद डर्मेटोलॉजी में 2008 से प्रैक्टिस कर रहे हैं, और इनका जो एरिया ऑफ इंटरेस्ट है डर्मेटोलॉजी है, आयुर्जेनेटिक है, अगत तंत्र है इनका, और इनका 16 साल का पीजी का एक्सपीरियंस है, टीचिंग का एक्सपीरियंस है, और यूजी में पढ़ाने का 14 साल का एक्सपीरियंस है। और ये कई पीजी स्कॉलर्स के गाइड के रूप में अपना कार्य कर चुके हैं, और कई जगह गेस्ट लेक्चर के रूप में, रिसोर्स पर्सन के रूप में लगभग इनका 138 जगह इन्होंने अपना लेक्चर दिया है, और इनका 30 पब्लिकेशंस है। तो ऐसे मूर्धन्य विद्वान आज हमारे बीच में मुख्य वक्ता के रूप में है। और हमारे यह जो प्रोग्राम है नस्या का आयुर्वाणी, इसमें हमारी भरपूर कोशिश रहती है कि हम जो आयुर्वेद के प्रैक्टिशनर हैं उनकी जो नॉलेज है, उनका जो एक्सपीरियंस है, वो किस प्रकार से हम सभी आयुर्वेद प्रैक्टिशनर्स और जो आयुर्वेद फ्रेटर्निटी है उनके बीच में उसको शेयर कर सके, उसमें एक नस्या एक प्लेटफॉर्म के रूप में कार्य करती है। और इसके लिए हम लोग पिछले वर्ष से यह कार्यक्रम चला रहे हैं, और इस प्रकार का कई कार्यक्रम नस्या की ओर से आयोजित किया जाता है। तो आज के इस प्लेटफॉर्म पे नस्या ऑनलाइन क्लिनिकल जर्नी आयुर्वाणी, जिसका हम लोगों ने नामकरण किया है, इसमें सभी का स्वागत है। और मैं आज के मुख्य अतिथि श्री सुरेंद्र सर से आग्रह करूंगा कि वे इस कार्यक्रम के लिए आशीर्वचन एवं उद्घाटन करने की कृपा करें। डॉक्टर सुरेंद्र सर।
Thank you. Good evening, everyone. It is my honor to inaugurate NASYA Ayurvani, the clinical journey. I congratulate NASYA India for organizing this excellent platform to connect ancient Ayurvedic principles with modern clinical practice. Today's topic, Ayurveda Dermatology Principles to Patient, is both relevant and timely, gives the growing need for holistic approaches to skin health. I thank Mahesh P. Savalagimath for sharing his expertise with us today. His insights will surely help practitioners translate Ayurvedic wisdom into effective patient care. I also appreciate the efforts of Raman, Ranjan, Chandramauli Yadav, and the entire NASYA team for making this event possible by utilizing platforms like Google Meet and social media. You are ensuring that this knowledge reaches a wider audience. With great enthusiasm, I declare NASYA Ayurvani, the clinical journey, open, and I wish everyone a fruitful learning experience. Thank you very much. Jai Ayurveda.
Thank you, sir, for your kind words. और इस कड़ी को आगे बढ़ाते हुए, क्योंकि नस्या का ये मोटो ही है सर, जो आपने कहा कि हम लोग किस प्रकार से सभी वैद्यों और आयुर्वेद चिकित्सकों के बीच में इस जो आयुर्वेद की जो विजडम है, आयुर्वेद के जो बेसिक्स हैं, उनको हम प्रैक्टिशनर के बीच में कैसे पहुंचाए, उसी के तहत यह नस्या आयुर्वाणी कार्यक्रम चलता है। और ये हर एक महीना के 3rd सैटरडे को हम लोगों ने इसको शुरू किया है। अब इस कड़ी को आगे बढ़ाते हुए मैं आग्रह करूंगा आज के मुख्य वक्ता डॉक्टर महेश सर से कि वे अपने वक्तव्य को यहाँ पर प्रस्तुत करें और व्याख्यान को प्रस्तुत करें। डॉक्टर महेश पी सर।
Namaste, sir. Very sorry. Just a minute. It is something happening with my PPT.
ओके सर। और यह मैं बता दूं कि नस्या का यह आयुर्वाणी ऑनलाइन प्रोग्राम जो है, यह गूगल मीट के माध्यम से तो हो ही रहा है, साथ ही साथ फेसबुक लाइव और यूट्यूब, नस्या का यूट्यूब चैनल के माध्यम से लोगों तक पहुंच रहा है। और इसके अभी ऑनलाइन के जो डेलीगेट या जो व्यूअर्स है वो देख रहे हैं, साथ ही साथ बाद में भी बहुत सारे व्यूअर्स इसको लाइक करते हैं, देखते हैं और अपना नॉलेज गेन करते हैं।
listen it. I hope the tutorial was helpful.
It has become reverse, sir. Just a minute.
Yes.
It is becoming again reverse. Ulta pulta slide. Becoming flipped. हाँ उल्टा हो रहा है सर वो
एक्चुअली लगता है सर वहां पर बटन दब गया है जो एप्लीकेट हो रहा है, मतलब उल्टा हो जा रहा है सारा सीधा सारा चीज।
सर
किधर है समझ नहीं आ रहा।
Alt and up सर प्रेस करिए, शायद ठीक हो जाए। Alt and up arrow।
Alt and up नहीं हो रहा है सर।
With control की सर, with control की।
डायरेक्ट पीपीटी शेयर कर दीजिए सर।
डायरेक्ट पीपीटी शेयर करूं?
यस सर।
ओके सर, ओके जस्ट अ मिनट शेयर। विजिबल सर? हेलो?
नहीं शेयर नहीं हो रहा है सर।
नहीं शेयर किया मैं, नहीं हो नहीं रहा है। इट इज शोइंग स्टॉप शेयरिंग। देखो सर अभी
नहीं हुआ है सर।
शोइंग शेयर।
अब फिर से कीजिए सर।
एक मिनट सर, मैं फिर इसको शो पे निकाल के
सिर्फ प्रेजेंट नाउ में जाकर कीजिए सर, वहां पर नीचे बटन होगा प्रेजेंट नाउ।
हाँ सर वही कर रहा हूँ मैं, एंटायर स्क्रीन करता हूँ। देखिए स्क्रीन दिख रहा है सर?
नहीं सर।
अभी दिख रहा है?
नहीं सर, अब हुआ सर। हाँ अब हुआ गया।
हुआ?
नहीं फिर चला गया सर, हो रहा था लेकिन चला गया। इंटायर स्क्रीन लगता दिख रहा है सर।
अभी
नहीं प्रेजेंटिंग में आ रहा है सर, लेकिन आपका हाँ स्लाइड नहीं दिख रहा है सर। हाँ अब दिख रहा है।
स्लाइड शो नहीं आ रहा है?
अब हो गया, अब हो गया।
दिख रहा है?
यस सर, यस
ओके
क्लियर है सर।
Technically little bit weak I am. So I'm very thankful to NASYA Organization for inviting me into this session, and I'm very thankful to the guest for attending this. And without delay, I will start. A warm wishes from KL University, Sri B.M. Kankanwadi Ayurveda Mahavidyalaya. We are under KL University, Kankanwadi Ayurveda Mahavidyalaya. So it is said that we need to be very grateful always, to our teachers. So these are 4 teachers. I can say that if at all I'm doing anything in the field of Agatantra and dermatology, it's all because of these 4 main gurus. So it is said that ekam eva aksharam astu guru shishyam prabodhe prithivya nasti tadravayam yaddattvana cha andunibhavet. So we cannot be come out of their graces. So it's all credit to them. So today we are going to discuss about application of some of the principles, Ayurveda dermatology principles to the patients. There are so many principles, like when we read into the Kushtadikara, Visarpa, or any other, like where the conditions where the skin diseases are explained. There, if we see, there are so many things which appear. Means when we read, we understand, but when it comes to the patient care, most often we fail to apply them because the explanation in the text is different and the presentation, what we see in clinical practice, is entirely different. So that is what is why we need to practice Ayurveda dermatology. Why it is essential to practice Ayurveda dermatology as a specialist or even in general practice. See, when we look into the general practitioners, they too have routinely, if at all they are attending 50 patients or 40 patients a day, in that at least 10 patients will come with one or other skin presentation only, skin complaints only. So it is very important because the skin diseases come with 2 main burdens. One is the humanitarian issue and the commercial issue. Means there are 2 very important values that if we practice dermatology, we can gain. We are going to attain that. The first one is humanitarian value. Humanitarian value means what we can call is punya, call in our science. Like, patients come with so much of suffering. Like unmarried girl, her marriage is denied or held back because of the skin disease. Because of that, her other sisters are getting suffered. There is a professional, for example, there was a criminal lawyer. He is a criminal lawyer. He was a very very successful practitioner, but all of a sudden he developed a kama plantar psoriasis. Now imagine a criminal lawyer or any advocate who has to be very active in every Hello? Am I audible?
You can continue, sir. Somebody had.
Was that from my laptop?
No, sir, from other side.
Okay. Okay. So he has to meet every day, means they have to meet every day many people and they have to shake the hands. Now imagine if the person is having, fully scaly palms, and how can that person, shake hands and meet with the people? So he stopped practicing, his advocacy for 2.5 years. Criminal lawyer, successful criminal lawyer, not going into practice, not going to court, not attending court because of kama plantar psoriasis. Imagine how much the pain that patient is going through. I can tell that the first day when he visited, he was not at all visiting into my eyes. He was, he was looking towards the door and he was talking. And I used to ask them to turn this side, but he was reluctant to turn. In 3.5 months, he was back to the business. He started attending the court. That is the beauty of Ayurveda. So much of sufferings the skin patients have. Like most of them, in psoriasis, I'm telling, like there was a patient with Aji, grandmother of a child, newly born child. She is having dermatitis all over the body, and she want to take the baby in her hands, but she is not allowed because she is having skin problem. So how much the pain she is having. These are our humanitarian values that we are going to contribute. Next is commercial value. See, the data says skin diseases are 4th most common cause of human illnesses, or 4th most common cause which make a person to visit a doctor. Skin disease. So much important, like so much is the incidence and prevalence of skin disease. So that is why we need to be very expert. We need to be expert in skin disease. Why Ayurveda people has to be expert? Because in modern medicine, even if anybody attend on YouTube also, they too can, even modern people also see, they will agree that there is no right medicine for most of the skin diseases. Hello.
Somebody which has name Mercury XQ, please you unmute your microphone. You
It's
have
not my laptop. No, sir.
no, sir. Somebody has disturbed the session.
Okay.
You continue, sir. You continue.
Okay, that is what is the the number of patients they visit in India. Let me give you example of just psoriasis. I'll give you an example. See, it was published in 2019. Survey was done in 2013 related till 13. Survey was done in US. Only for psoriasis, I'm telling. Only for psoriasis. Here you can see my cursor. I'll turn on the pointer. See, the annual US cost for the psoriasis patients approximately 112 billion in 2013. It is the time when biologics were not there. Now they have started using biologics. Biologics injections, one injection can cost from 60,000 to 1.5 lakhs, one injection. And they have to take multiple times. Today only in my OPD, I saw one patient visited. He had a small psoriatic patch and he was given 15 biologics injections under trial, and each injection cost was 23 to 26,000 rupees. And he took 15 injections every 15th day. Now, after 1 year or 2 years, now he had a small skin lesions all over the body. That is the cost of psoriasis. Now, imagine in India, in US, the population is 34 to 36 crore. In India, right now, we have more than 140 crore. Now, what may be the annual expenditure of patients just for psoriasis patients in India? It is in a survey. It is said that on an average, skin patients, whenever they visit a dermatologist, modern dermatologist, they pay per visit. They pay 2,500 rupees average minimum with minimum medicine. Simple fungal infection patients come with around 4,000, 5,000 rupees payment, like including consultation fees and medicines. So costly medicines are there. Again, as long as the patient is taking medicine, the result is there. Once the medicine is stopped, again the condition recurs, maybe after a month or 2 months. Okay, that is the burden. Means it is a sign that there is so much of financial value also. If we are able to give very good results, if we are going to give very good results, we can have a very good share of that much commercial value. And even we can reduce the burden of the patients, like how much they are paying right now. If we are going to practice dermatology, Ayurveda dermatology, we can reduce their payment, paying, and also earn also with ethics. And simultaneously we are going to gain a lot more than that. Like this is the reference of Rasarna. One of my teacher gave me this maybe some 6 or 8 years back. This is Rasarna. Kanyakoti Pradhanena Gangayam Pitrutarpane Vishweshwara Purivase Tatphalam Kushtanaashani. What Rasarnavtar says that Kanyakoti Pradhanena means if we do 1,000 Kanyadana, or if we do Pitrutarpane in Ganga, or if we do Japa Tapa Homa in the Sannidhi of Vishwanath, Kashi Vishwanatha, what punya we are going to gain, what righteousness we are going to get, that much we are going to gain by treating one Kushta patient successfully. Further he says, Gavam Koti Pradhanena cha Ashwamedha Shatena cha Vrushot Sarge cha Yat Punyam Tat Puraya Kushtanashini. See, this is what we are going to gain, dharma or punya, what we call. This is what I was telling about humanitarian value. And right now I told how much a patient spends for skin disease. Right? So this is all is so important that is why we need to be expert. Even if you are not practicing dermatology exclusively, no problem. Make it as a part of your routine general practice, where whenever skin patient comes, you treat them. I think in this 1.5 to 2 hours I have, in that I will make sure that at least you will treat in next time when you come across with any skin patient, you will be treating those skin patients with little more confidence. I'll make sure that. Okay. So what are the principles? These are my opinions. Okay. These are my understandings when I go through, when I study dermatology and when I'm practicing. Throughout my practice, I have understood that there are so many, principles which we need to be understand them in a more practical way or more clinically oriented or applicable way. Like principles of etiology. I will explain them one by one. Samprapti, Doshi assessment, frequent Shodhana is there, Snehapana is there, Clear and Krimi, we we read in almost all samhitas, we read Kleda and Krimi, Rasayana is there, and patient education. Patient education may not be explained directly, but it comes in Patya, Ahara Vihara and all. Okay, these are some of the things I feel are base for any dermatologist to gain some mastery. If we gain mastery in these things, I think I can say that we can treat any type of skin presentation, even if we are not able to diagnose what that disease is. Okay, so we'll understand ethopathogenesis first. First, we'll have some concepts and then we'll discuss the cases. Like Ayurveda, what we see, the etiology, this is very important. Every time I tell my even UG students, undergraduates and postgraduates, if you go through any modern medicine book or pathology book, except for food poisoning and some other malnutrition, we do not get any disease, in any disease context, we do not get food as one of the etiological factors, right? This is very important, where we have dominance. Like Ayurveda has explained a lot on related to food and lifestyle. That is very important. See, we have studied this. I am not going to read all these things. In general, just I will tell you what are there. There is Viruddhahara, Mityahara, Chardi Nigraha, Shitoshna Akrama Seva, Langana Akrama Seva, Vyayama Sevana after heavy meals, or Shita Jalapana soon after long exposure in the sun, heavy work. These all are practically seen. Like for example, simple Viruddhahara. Whatever fried items we eat outside, they all come under Samskara Viruddha. Because our science has said we should not reheat the oil. Right? Then what happens in hotels? Same oil is regularly used on every day. Right? That is one of the simple way, a simple example. Like the meat should not be, any non-vegetarian food should not be deep fried. Now deep fried non-vegetarian foods are very popular, right? Chardi Nigraha means, I usually tell my students, Chardi Nigraha can be considered as repeated use of antacids with antiemetics. This is one of the way, understanding how we need to understand in contemporary way. This is what we need to do. Shitoshna Akrama Seva. Like you go to any hotel, there will be display of puri bhaji with a coke, or dosa with a coke, hot dosa with coke, hot biryani with coke. If you go to those whatever these, I'm not remembering that foreign fast foods are there, like a burger, pizza burger, or the non-vegetarian shops. They serve a burger with a coke. The burger is hot and coke is cold. Shitoshna like Akrama Seva, Langana Akrama Seva. Morning to evening we do sometimes fastings, and all of a sudden at the night we have heavy meals. This is wrong. Vyayama Seva soon after heavy meals. This is also done. Shita Jalapana, very common in so scientific sports also. We can say like nowadays sports has become very scientific. But what happens there? The players are playing under the sun, and whenever they want water, they are served with cold water, chilled cold drinks. Like these all are what we see. Panchakarma Upachara is there. Ajirna Asana, Adhyasana, Vyavaya while having Ajirna, Asatme Seva, Diva Sopna, very common. Papa Karma, I don't want to detail anything about that. Papa Karma, only one thing I would like to say, like, for example, in Ayurveda it is said Prani Hatya or Guru Ninda, like Sajjana Ninda and all it is said. So there what we need to consider, like sometimes people ask, like students ask, like, sir, a butcher shop, a person who is working in mutton shop, every day that person kills so many animals. Why that person is not developing any of the Astamahagatas? Now, here Papa Karma, it starts causing disease once the person starts feeling guilty about what he or she has done. So that guilty feeling makes the person start suffering from the disease. So that is what is Papa Karma. Okay. So generally, what it says, exposure to these etiologies, Vidya, Pitta and Vata, Kapha. And then Vata takes that to further stages and leads to Kushta. If at the early stage, if we do Shodhana, there will be no Kushta. But if we neglect, then the Kushta will be caused. Now, there are Saptadushas. They accumulate more Kleda. This is what we come to know in that. Now, food is the main head. When we look into that, most of the diseases, it is again associated with the Trayopastamba, Ahara, Nidra, Brahmacharya. Okay, Ahara and Nidra means we have Vihara, we can consider Vihara and Vichara. Vichara also will come in skin because the anger, the greed, the depression, these all are going to fear and all. These all are going to aggravate almost all skin diseases. They are going to aggravate almost all skin diseases. Now, when we consider this, most of the etiologies fall under the category of food, right? We'll see what is there in present day food. You can see this present day food, what it is having, it is full of chemicals. There are residual pesticides, there are residual fertilizers, there are coloring agents, there are ripening agents. Like in all over India, whatever banana, mangoes are ripe, no, they are ripe using calcium carbide. Calcium carbide enters inside the fruit also, banana also. The grapes, highest pesticides, fertilizers are used. All these, all vegetables, the colors. Not only these, the creams that we eat, jellies, jams, and all we eat. There are adulterants are there. There are preservatives are there. Taste enhancers are there, right? Ajinomoto and although they are banned, they are still in practice. These all are there in this present day food, right? So overall, those all are nothing but they are low potent poisons. Those poisons we call them as dushyusha. Okay. So overall, when we look into this, you can see food, drugs, and beverages related foods, unhealthy diet practices, food articles, additives, residual chemicals, fertilizers, pesticides, all those things come. Hair care products, irrational medicines, okay, lifestyle in that, stress, greed, occupational exposure to chemicals, pollution and all, environment, pollution, indoor and outdoor, both are going to contribute. Okay, so contemporary understanding is like in present day food, these all are there, like vegetables, pesticides, fertilizers, etc. Fruits, pesticides, fertilizers, ripening agents. Meat, it doesn't mean that non-vegetarians are safe. No, non-vegetarian food comes with lots of medicines, hormones, pesticides, fertilizers, and even steroids also added to increase the bulk. Okay. To add to this, there are adulterants, additives, preservatives. Other than food, irrational medication, over-the-counter medication, occupation exposure to chemicals, pollution, all those things. So many things are there. When we look into the Viruddha, just simple one example we will take from Kushta. Okay, Viruddhahara is one of the prominent etiology in Kushta. Okay, we see one or two examples of Viruddhahara. Okay, like for example, Matsya and Dugdha, or it is said milk and milk products with non-vegetarian food. Milk and milk products with non-vegetarian food. This is naturally Viruddha, right? It is naturally Viruddha. Now, how we need to understand in present day? Now, present day, aquatic animals are the highest reservoirs of heavy metals, because whatever industrial effluents, industrial waste or domestic waste, everything we are going to dump them, mostly it is dumped into sea. Everything finally, ultimately it is dumped into sea. And that heavy metals come into these aquatic animals. Fish are the rich sources. The meat, other than fish, they comes with medicine. They come with pesticides, fertilizers. Pesticide fertilizer, how? Because to graze those animals, the goat, whatever it is, all those things, they have to cultivate some grass and all. To grow that, they add pesticide fertilizer again. So that comes into plant circulation and then it enters into that animal circulation. And this is about the non-vegetarian. Milk comes with adulterants. Milk comes with adulterants. It's it is good if we get adulterated more milk. Instead, there is a chance like we may get completely synthetic milk also. Right? We may get synthetic milk. Okay, so now also it is Viruddha. Is it okay? Is it right to consider this Viruddha as just Viruddha? Or if this Viruddha causes some skin diseases, is it okay to consider that skin disease as Viruddhaharaja or something else? Because this Viruddha is coming with Visha, means it is Savisha Viruddha. Let me give you one more example, like banana. Fruit and milk is Viruddha and it's one among the etiology of Kushta. Right? Banana and milk is commonest in practice everywhere. In Karnataka at least it is there, in South India it is commonly practiced. Now, milk comes with adulterants and banana comes with calcium carbide. Again, it causes skin disease. Now also if we call it as just Viruddhaharaja, then somewhere we are missing. And with that principle, if we are treating the patient, then we may not get the right outcome or anticipated results or what we want to get out of that treatment, we may not get, right? So, as we are saying, these all are low potent poisons or poisons. Why they are not causing any immediate effects? Usually, everyone will get the question. It's very, difficult to explain sometimes. Patients like they come and ask, Doctor Sir, इससे कोई क्या बोलते हैं? Allergy, adverse effect तो नहीं होगा ना बोलते हैं? The person who is consuming so much of chemicals never worried about that. Right? When it comes to medicine, they ask because they have hope. They hope that at least this will act. this will give better result, this will help me to get rid of the condition. Okay. Now, these all are low potent poisons. These all are low potent or altered poisons. So that is why they do not cause immediate clinical manifestations. So they all are acting, they all are showing delayed manifestations, and hence they are called as Kalantara Prakopisha. Over a period of time, they get, means they go on accumulating in the body, or their effects go on accumulating in the body. We sure that poison may come and go out. For example, paracetamol-induced liver hepatotoxicity. Now in that, actually, paracetamol molecule will not stay in the body beyond 42 hours or 48 hours. But still it is going to cause. Means the effect of its, like paracetamol molecule, whatever effect it is causing on the liver, hepatic cells, that is going to accumulate. So likewise, even though these low potent poisons, they may get eliminated immediately, but as long as they are there in the body, they do their target effect. Whatever effect they have to cause, they will cause. So when we get exposed continuously, the effects goes on accumulating, and then they lead to the clinical manifestations. So these all come under the category of low potent vishas. We consider them as dushi visha. They are synthetic, so we consider them the gara visha. As they are showing delayed manifestations, they are dushi visha. So we can call them as garajanya dushi visha. So all these lead to accumulation of low potent poisons or toxins in our body. Years together they stay in our body, which is said in gara visha context that kapha avrutam varsha ganan bandi. It gets encapsulated by kapha and stays in the body years together. For years together, it stays in the body, and then they affect our immune system. Why immune system? Because the main target of visha is oja. Right? We consider oja as bala, which is nothing but immune system. So ultimately, they affect immune system. We consider them as dushi visha, low potent poisons. By affecting rakta, they cause skin disease. It is said dushi visham tu shonita dushtaru kitibakota lingamcha. Like that. If they affect rakta, they cause rakta dushti, then they lead to skin disease. By affecting oja, they bring in autoimmunity and all. So many immune related changes. That may be autoimmunity, that may be hypersensitivity, like anything like immune related, or a person becoming very prone to get repeated infections. All those things are caused because of these low potent poisons affecting oja. Okay. Now, so though hetu remains same. Okay, hetu remains same in all the skin diseases. Not only skin diseases. You go and read every disease in Charaka Chikitsa Sthana, whatever 30 chapters are there, or leaving 4 or 5, 26 or 25 diseases. In that, you will find same etiology for everything. Okay? Etiology is same, but the clinical presentation goes on changing because samprapti is different. So that is why we need to understand samprapti as per the disease. Understanding samprapti means not just understanding the words in the shloka. Like in that shloka, we saw what happens there. Pitta and kapha get aggravated, and then vata takes it to the skin and causes skin disease. No, it's not enough to plan treatment, right? So I will tell you with examples how we need to understand samprapti and how we can plan the treatment. Okay, so it should give us ultimately. I will explain that in that slide. When you will understand there, I will be explaining with the patient. There you will understand that how we need to study samprapti of any disease, and simultaneously we should be reading contemporary also. Like for example, if I am treating psoriasis, whatever I consider in Ayurveda, maybe Sidma Kushta, Kitipa Kushta, whatever, simultaneously we should be knowing psoriasis also, right? If we are treating eczema, we may consider Vichachika. Modern eczema also we should be knowing, because eczema etiology is different, etiopathogenesis is different, psoriasis etiopathogenesis is different, but in Ayurveda, for Sidma also same Nidan Samprapti, for Kitipa also same Nidan Samprapti, Vichachika also same Nidan Samprapti. But clinical presentations change. Okay, so this is said about samprapti, right? Tre dosha yugapat prakopam apadyate togadesh chatvaro shaitilam apadyante teshu shitileshu dosha prakupta sthanam adhigamya santistamana sthaneva togadin dushyante kushtani abhinirvartanti. Say, like, three doshas will get vitiated, and then they vitiate remaining 4 dhatus, and it will become saptadravyas, and they get settled in the twak, and they cause twak dushti and leads to skin disease. Same is there in Sushruta also. Acharya Sushruta also explains same thing. But when it comes to clinical presentation, when we see in clinical practice, see, the pathogenesis is same. It is same. If pathology is same, why the presentations are varying? Why the presentations are varying? This is what I was telling in the beginning. How we need to understand the principles. I tried to explain you the principles of etiology. Whatever etiologies are explained in Ayurveda, we need to understand those principles and in the terms of contemporary. आज क्या है वो, उसके हिसाब से उन्हें हमें समझना है. अभी उसके हिसाब से what we understood that contemporary etiology, present etiology, whatever it is, it comes with Savisha. It becomes Savisha. Whether it is Viharajanya, Savisha Vihara only. Because environmental pollution, occupational exposure. If it is Aharajanya, Savisha Ahara only. If it is Viruddhahara, Savisha Viruddha. All like that is one of the principles we are going to get there. Now here, Samprapti, what is there? Samprapti is same. 2 doshas, get Prakupita, then vitiate the remaining 4 doshas, become Saptadravya, go to Tvak, there they cause Tvak Shaitilya, and then manifest skin disease. Pathology is same, but presentations are varying. See, this first one is psoriasis, where you can see scaly lesions. Second one is folliculitis, pustular, very acute manifestation. This is a little bit chronic. This folliculitis is very acute. 4-5 days the person develops. This is allergic footwear dermatitis. Presentation is different. This is chemical leukoderma. This is entirely different now. But in Ayurveda, the pathology or Samprapti explained for all these is same. Pathology remains same. So that is why we need to be knowing the contemporary diseases. Like when we study psoriasis etiopathogenesis, if we are able to interpret that psoriasis etiopathogenesis in terms of Ayurveda, we will get right targets to plan the treatment. Same is true with all the diseases. Same is true with all the skin diseases. It can be applicable to other than skin disease also. Okay. Now, how I select medicines? Like when we look into the Karya Karana Bhava, right? So medicines, while selecting medicines, we need to link into both Karana and Karya. We need to consider both Karana and Karya. Why Karana is important present day? Previously, Karana was important in Kushta to advise Patya, right? To ask the patient to avoid a Patya and start using Patya Vihara and all. But present day, it's not only Patya, it is about what it contains. So Karana, when we look into most of the diseases, what we saw, it is Savisha. So to treat Karana, we need to be irrespective of the disease, we need to be giving Vishagna Pravyas. Now Karya means what? This is Karya. These all are interconnected. Now this is Karya. Now what is Karya here? It is Acharya Charaka says how to understand Kushta. Further he says that 7 Mahakushta, Ekadasha, Shudra Kushta and 18. He goes on explaining that as the doshas get divided, we may get Aparisankheya. Further he says that as the clinical presentation will be there, dosha assessment you have to do, the disease will become. So Karya means not the name of the disease. Name of the disease also okay. But dosha manifestation, what lakshanas are seen, why those lakshanas are seen, or what those lakshanas are telling us. Tarkacharya says, if you are not able to understand, see the lakshanas, understand which dosha is dominant. If you are not able to diagnose the disease by name, I give an example and tell you. Even if you do not know the name of the disease, you can treat it without knowing the disease. Okay, if you know the disease, contemporary disease, it becomes more easy to plan the treatment. So Karya means the outcome, what it has caused. Even if we are diagnosing by name of the disease, okay, name. In that disease, what is the clinical presentation? That presentation is telling about what doshas and how we need to plan for those doshas. Okay. Next is again Karya Karana only. There, for example, here Karana, outside, exogenous, external Karana. Karya is what happened inside. Now, most often this Karya will become Karana, internal Karana for other Karya. For example, I told you the present day food because of Dushivisha leads to autoimmunity, right? So that Dushivisha is Karana, autoimmunity is Karya, right? This is one step. Now, is autoimmunity a disease? No. Now, autoimmunity can cause number of diseases. So now autoimmunity is acting as Karana for another Karya. So, for example, now I give you an example of psoriasis. Now, Dushivisha Janya, patient has developed psoriasis. Now, Dushivisha, Karana we consider, so we are treating with Vishagna. So Karya is autoimmunity. So I consider Krimingrathas as best for treating autoimmunity. So I will add for autoimmunity, I will add Krimingrathas. Now this autoimmunity has led to another disease, that is psoriasis. So here scaling is there. So I need to treat for that scaling, right? Targets became 3 now. So here just Karya and Karana and Karya. Here Karana, Karya, Karya becoming Karana and leading to another Karya. I think it's not confusing. Hope just a minute. Okay, we'll now discuss all these with case. Okay, we'll discuss all these with case. Now, many times what happens now, people say Ayurveda is slow. Ayurveda do not give immediate results, or it's very slow, may not be effective in infectious diseases and all. It's not right. It is it's a misconception, because the patients are slow to us. They do not come on first visit. No, recently I was in Kerala. There was an ROTP or CME, CME. I was talking to my friend Dr. Gopikrishnan. What is the percentage of Malayalis or Keralites opting for Ayurveda as first line of treatment? It is 46%. One of the study has said only 46% of Keralites opt for Ayurveda as a first line of treatment. In a state which, not only in India, globally, the people consider that it's one of the best place for Ayurveda. Now imagine other states where first choice of Ayurveda may be less than 10%. Maybe less than 10%. Even in chronic disease also, non-communicable disease also. Okay, so what happens? The patients, I can say that so far in 18 years, I have never seen, sometimes, our own students, they go to modern doctor, get treatment. Then when it is not get cured, then they come to us. I have never seen a first-hand patient, mostly. All are second, third, fourth hand, fifth hand, like that. Transfer, changing the doctor and coming to us and say, doctor, we have tried everything. Now we have come to Ayurveda. And they top it with, if you promise 100% result, we will take medicines. Sometimes, I get very much annoyed by that, angry. I get angry, and sometimes I have scolded also patients. But we should not do like that. So this is a case of leprosy. Okay, a patient came with these type of presentations, lesions. See, this type of lesions on, this is on right foot, this is on left foot, toes. See, left foot, the toes are under autoimmutation. They are getting autoamputated. And here you can see the wounds. He's not having sensation here in this foot. Okay, this patient came to me with this type of presentations, and he was having some mental retardation. As per his explanation, what he said that patient of psoriasis, please don't mind about my handwriting, it's my handwriting, since many years, and he is under therapy, leprosy treatment protocol since 8 months. He told like that. So there is always a need for communicating, like it is one of the notifiable diseases. Leprosy is a notifiable disease. So usually what we do, we refer the patient to the leprosy center, and then we do. If they send back to treat, then we do. So what happened, he has already taken treatment and there was no cure. And he has taken the medicine for 8 years, and last 8 months, he has stopped. I told you he was having MR, so he was not able to communicate properly. So then he sent back, the doctor sent back, and we can treat like that. So we started the treatment. This was the presentation. Okay, many years he is having that one. So now you can see this is the presentation on 29/6/2024. Now let us understand this based on what I said, how I select the medicine. Now Karna and Karana. What is the Karana? This is the reason why we need to be knowing the modern hospitals. The modern hospitals. Imagine if we do not, maybe our acharyas, I'm not talking that only with Ayurveda also it's possible to diagnose or not. I'm not against that. But for me, I use this principle. This is very easy to practice. So now, as per the modern, leprosy is caused due to virus. It's a viral infection, right? The Karna is virus. So what should be the treatment? Bhutagna. I consider virus as Bhuta. Many contexts we can make sure that a virus can be considered as Bhuta. So I consider it as Bhuta and Bhutagna. Okay. What is the Karya? What is the Karya here? You can see Pitta Kapha or Kapha Pitta dominant presentation is there. Okay. It is Pitta Kapha. We can call it as Pushta or Vrina. No problem. Now we can consider it as Kushta. Many days it is there. So Pitta Kaphaja Kushta. Okay. Hello.
No, sir. Continue, sir.
Okay. So what should be the treatment? Kushtagna, Vruna Shodhana and Dropana. This should be the approach. Now what I did, okay. Yeah, that don't go by my handwriting. Whatever I have written here, PKR, Vilwadi, Trifla, Nalpamradi, here I have typed it to make it very easy. Okay, Patola Katranadi. What I PKR is Patola Katranadi. I prescribe Patola Katranadi Kashaya, 15 ml thrice a day before food, 1 hour before food with warm water. Okay, Vilwadi Gulika. It is Vilwadi Agada textually as per the text. In market, it's available as Vilwadi Gulika. So Vilwadi Gulika, 2 tablets thrice a day after food. Okay. Actually, I wanted Panchavalkala. You can see I have written here Panchavalkala and striked. Actually, I wanted Panchavalkala for doing sake because Panchavalkala is more Vruna Ropana Shodhana Ropana than Trifla. It was not available in our hospital, so I recommended Trifla. Okay, then Nalpamradi. Nalpamradi is again Panchavalkala. In that Parisha is not there. Haridra, Chandana, Ushira are there. This is also very good for Pitta Kapha dominant Kushta, Visarpa, and all. It's very good. So I prescribed this. Okay. This is the presentation on 13/7. When I prescribe this, 29/6. Now, I need to explain. Now, Patala Katanadi is Pitta Kapha, Hara, Kushtagna, Vishagna, right? Vilvadi Gulika, Vishagna also, but it is said, Pujangalutondar Uschikade, Visuchikajirna Garajarascha, Arthanaran, Bhuta Vigarshitascha, Swati Karoti Anjanapan, say. It says Bhuta Vigarshita. If the person is suffering from Bhuta also, it cures. So, Bhuta means viral infection. So, for that, I added Vilvadi Gulika, Trifla, Nalpamradi, Vruna, Shodhana, Ropana for that. Okay, 29/6. This is on 13/7. You can see the wounds are healing. The left foot, you can see amputation has stopped. It started healing. Okay, then what I did, now the Pitta, you can see here, Pitta Kapha Lakshana is reduced, right? It is reduced. Now healing we need to enhance. So what I did here, in place of Patala Katranadi, I added Nimbadi Kashaya. 15 ml thrice daily after food now. Why I put before food Patala Katranadi? Because I needed little Virechana effect, purgative effect. Okay, Pitta Hara. Now Nimbadi is also Kapha Pitta Hara, but it's more Vruna Ropana Shodhana. It helps for healing the wounds. So Vilvadi, Nimbadi Kashaya 15 ml thrice daily. Vilvadi Gulika I added thrice daily, 2 tablets thrice daily. Now I reduced the dose because severity has reduced, right? Vilvadi Gulika 1 TID after food. Trifla, Nalpamradi continuing. This is 13/7. 27/7. Lesions reduced, but chloride increased because it was the period when we started here in Belgaum. There was heavy rain. You can see this whitish shrinking of the skin and all. This person has walked under rain on more this water and all. So again, chloride increased. Wound has got enhanced. Now chloride increased. So here we have to, every time whenever patient comes, we need to think about cardiac. What is the condition of the cardiac? Here, the condition of the cardiac changed, so medicine changed. Here now condition of the cardiac is again changed. It is a little bit different now. So we need to change the treatment. So Chloride is more, Kapha is more. So in place of Nimbadi, I added Araguradi Kashaya twice daily before food. 15 ml twice daily before food. Vilvadi again, instead of 1 TID, I made it 2 BD after food. Panchavalkala was available. Actually, in the first stage only, we would have got that one, we would have got the better results. But now it was available. So I replaced Trifla by Panchavalkala. Nalpamradi continue. Now what we are playing with, we are mostly playing with the drugs that are acting on cardiac, right? Like Patolakatranadi, Nimbadi, Aragudadi, right? Trifla, Panchavalkala. We are changing and all with that only. The Hetu we are keeping as it is. The medicine for Hetu. This is on 2/9. This was on 27/7. This is on 2/9. You can see marked healing is there. Small wound is there still. Okay. Now patient came here. Here I prescribed Vidangadi Churna. Again Trimigna. Trimigna is already Bhutagna is there. With that I added Trimigna. Vidangadi Churna is Vidanga, Amaliki, Trifla, Musta is there I think in this. This is our own preparation. But not by any intellectual thing. It is from Sushruta's reference in Anagata Bada, some Anagata Bada Pratisheda, somewhere it is said Vidanga Prayoga is there. There you can get the reference. Guduchi is there, Trifla is there, Estimudu is there, Bhallataka is there, like that. So from there only I have taken. So this is Vidangadi Churna, 1 teaspoon TID before food, thrice daily before food. Vilwadi Gulka continued. Now you can see it has dried up now. So no need of Seka. So you stop the Seka. Only oil is continued. This is 2-9. Today, actually, we wanted to call the patient. In the morning, I was telling to our students. Fortunately, patient came. This is today. You can see autoimputation has completely ceased. The wound has completely healed. And here you can see the gapping also became now. Here there was no gapping at all. It has improved now. Right? Wound has completely healed and it is a case of leprosy. It is a case of leprosy. 29/6, 19/10. Right? 7, 8, 9, 10. 4 months. Okay, 4 months. No problem. The patient is taking medicines, modern medicine for 8 years, 8 long years. And we are treating it for in a span of 4 or 5 months with very simple medicines, applying our own principles, blending like Kai Chikitsa, Agada, and converting the modern pathologies in a way we can plan Ayurveda treatment like that, understanding that. So you can see, here you can see gapping and all are not there in the beginning. This is 29/6, this is 29/6, this is 29/6, this is today. The patient is very happy, completely healed. Okay, so this is what even in infectious disease also we can do, Ayurveda can do a lot. Now this is a food allergy patient, right? The patient had food in a dhaba outside and she developed this mushroom or something. Okay, she developed it. I think you can see the boils, not small pilikas are there with erythema, severe itching is there on face also. Face got little bit edematous, neck, and even on trunk also she had, even on upper extremities. She had these. These are on 18/5. Okay, so now this 1 or 2 patients only I will explain this. Okay, to make it convenient, and then we'll go by patient. Okay, so here Karna is allergy is there, so we consider it as hypersensitivity is caused due to Dushi Visha. Right? I considered Karna as Dushi Visha. Visha needs to be given. Karya is Kandu, Raga, and Pidaka is there. Kandu, Raga, Pidaka. Here you can see a Pidaka are there. Kandu is there, patient is telling, and Raga is there, redness is there. Okay, so Kanduhara is important. We have to give Kanduhara. Now I gave, on that day I gave patient, around 12 patient came. Patala Muladi Kasha, 15 ml twice daily on empty stomach. Kanduhara, Pitta, Shodhana. It is needed. Acute manifestations, Shodhana is very important. So Patala Muladi works well. Dushi Vishari, 2 tablets twice daily after food with honey. Coconut oil only. Because there is no need of Nalpamaradi, Eladi, any something like Ushtagna type of oil is not needed. Just for soothing, reducing the itching, and that Ushna or Ushna Guna of Pitta. Okay, coconut oil is Tvacha also, Pitta. Okay, for that it was given. But what happened, same day evening, she was about to start the Kasha in the evening, she got menstruation. She called me. Usually, I give my phone number to every patient. Like if you have any problem, you can confusion also, you call me like that. And whenever I give Patal Muladi, I 100% give without forgetting also. If I forget, I ask my PGs to put that seal of my number on the patient's prescription, because it causes severe pain, abdomen. Sometimes patient may get severe loose motion, complications may happen. So that is why if at all such thing is there, patient have to call. It's good. Okay, so Patala Muladi, usually in menstruations, patients will be having on first day or second day, severe pain will be there. And Patala Muladi also causes severe pain. So I thought adding Patala Muladi in this condition may not be right. Okay. And if patient is having menstruation and frequent loose motion, again, a weakness may be there. So I cancelled Patala Muladi. I asked the patient to take Dushi Vishari instead of thrice a day after food with honey and continue coconut oil application. This is 18/5. 22/5. 18 evenings she started Dushi Vishari. 22 afternoon she has come. Means morning dose she has taken. 4 days, 3.5 days I can say. 3.5 days patient has taken medicines. You can see the result. This is again for some day, 4 days, no? So at least 10 days you take medicines like that I told. Dushi Vishari now instead of 2 TID raised to 2 BD, coconut oil application, continue. 1 TID, 2 TID के जगह पे 1 TID कर दे, thrice a day, coconut oil, continue for extra application. This is on 27/5. 18/5 she came, this is 18/5, 18/5 she came, This is 27.5. Completely all right. You can see the difference. Actually, 22nd itself, all the complaints were reduced. To get this type of results, वो जो analysis में बोल रहा हूँ ना, थोड़ा वो ध्यान देना. See, in Ayurveda, time is there. See, once what happened now, one intern from one college came to my clinic. He told like, I want to be in your clinic for a month or 2 months. I said, okay. At that, it was in the beginning. I used to get maximum 7-8 patients at that time per day. In the evening, I used to sit from 6 to 9. Okay, not more than that. Okay. So at that time, he came for first 3-4 days. And 5th day or 6th day, he asked me, sir, what you prescribe for fungal infection? I'm very open, I tell whatever I do. So I told him, I give this, that and all. He wrote everything. And he was not seen next 4-5 days. After a week when he came, on that day, I had, fortunately, 2 or 3 fungal infection patients. And I told him to diagnose the condition. He was not able to diagnose. But then I told the diagnosis, okay, it is the diagnosis fungal infection. I sent the patient, I prescribed medicine, and मैं उसको दिखाया नहीं क्या मेडिसिन लिखा, but later I showed. Okay, तो मैंने उसको बोला, you have written the medicines. Now you tell me which one you are going to write there. Don't know, because in Ayurveda we do not have, particularly in skin diseases, we do not have a treatment by name of the disease. We hardly have. Only there are some lepas like Sigmahara lepa, Shvitrahara lepa. Otherwise, even like 18 Kushtas are there. In that, you will never find a single formulation targeting single disease. No, we don't have. All the Kushtagnas, they have Kushtagna, and Doshagna said. Right? They come with other functions. So understanding those other functions and dosha is the prime importance of treating the patient. So, isko patient mein use karne ke liye, we need to be thorough in understanding the patient presentation, right? So that is why little bit analysis. No, it will not take much time. Very little. When we do, like when we say dosha assessment and all, we need to do like this. For teaching, it feels like that. When we see the patient, we assess all the 3 doshas at once. At once. There's no need like, take a pen and write what are the Vata Lakshanas, what are the Pitta Lakshanas, what are the Kapha Lakshanas, how much percent is Vata, how much, no. What? By seeing gradually, maybe in span, if you see some 100 of patients, that is enough. Even if you are not getting patients, don't worry. Google images. Okay, you Google the images and write just whatever disease like eczema, Indian patients. You put Indian patients because the Western presentation and Indian patient presentations are a little bit different. Okay, so see them, try to analyze. No need to have a real patient. You just try to analyze. Go to your library or go whatever atlas you have. Go to atlas. Open the page. You will get a skin photo. Analyze which doshas it is having. That is enough. To learn, you can get so many things. Even in absence also, you can learn. For example, I usually tell. I have some online courses there. I used to teach. Like I tell how to learn psoriasis using eczema patient. How to understand, like how to develop psoriasis diagnosis skills in eczema patients. Like excluding. Why this patient is not psoriasis? Because there is no scaling, because there is no silvery white scales, because there is no auspicious sign. Like नहीं है करके भी कर सकते हैं, है करके भी देख सकते हैं. मतलब we need just something like that determination to learn. Okay, this is a condition of phytophotodermatitis. It's a type of dermatitis. It has got 2 entities, phyto and photo. Okay, phyto is a plant, photo is sunlight, leads to dermatitis. Okay, this Ajji or old lady, she was preparing for bendi fry. She was cutting bendi, lady's finger. Lady's finger also having those shuka, hairy projections on it, and those two cause irritation sometimes, some people. Okay, वो किए वो और वो उसके करते वक्त वो पसीना वगैरह पूछी है. Then she has worked under sun. All of a sudden, she developed this redness and severe itching. So what happened here? Phyto, that exposure to that lady's finger, shuka, that hairy projections, After that, exposure to hot sun. Phyto, photo. What is the manifestation? Dermatitis. So phyto, photo, dermatitis. Now what I gave, Avipatti Churna, 1 teaspoon BD on empty stomach. It's not Avipatti Kara, it is Avipatti from Ashtangrodaya reference. Okay, it is Vishagan also. So Bilwadi, 1 TID after food. Actually, I wanted to give Patalmuladi. Very much suitable for this. Pitta, itching, acute. Okay, but she was 56 or so, above 50. So old age patient may Patalmuladi is not good. Severe pain abdomen in patients may not tolerate. So Avipatti is very good. Not that it will not cause any difficulties. So Avipatti, Bilwadi and Dushishari both I added. Bilwadi is very, have got in acute manifestations it is very good. Dushishari allergic के लिए. So इसलिए दोनों डाल दिया. Nalpam तेल I gave for extra application with coconut oil. Right? I gave this one on 24/6. This is 29/6. 5 days later, you can see more than 80% reduction is there. More than 80% reduction. 24/6. This is the presentation, and 29/6. This is the presentation. 5 days, 4.5 days medicines you can call. Right? This is the outcome. Now we'll go to another disease. First I explained that Karana, Karya. Now we'll see Karana, Karya becoming Karana, and then another Karya. Okay, we'll take example of psoriasis. Right? So present etiology, I told it is Dushivisha. This is leading to autoimmunity because we are taking psoriasis. So that is why I'm telling autoimmune, because psoriasis is an autoimmune disease. So this is leading to autoimmunity. Now this autoimmunity is acting as Karana for psoriasis. Right? So now we need to take medicines for Dushivisha, for autoimmunity, and for psoriasis. Right? Now in this, I'll explain you everything. Understanding etiology, understanding Samprapti, understanding patient education, understanding Rasayana, understanding autoimmunity, everything in this I'm going to tell you. So when it comes to the etiology of psoriasis, current etiology, Karana is Dushivisha, right? This etiology is leading to autoimmunity or recurrence of the disease. So now this is Karya. Now this Karya is becoming Karana. This is becoming Karana to increase epidermal turnover. This is psoriasis, right? This is the pathology in psoriasis, right? Increased epidermal turnover. So what is happening there? The skin cells, that span of 28 days skin cell cycle is reduced to 4 to 5 days or 3 to 4 days. Matlab early aging, and they are dying. So that when they keep on piling up on the skin and they become flakes and then they fall off. That is why we get those scaling, right? So this is Karya. It causes another Karya, that is Koebner phenomenon. Any irritation leads to aggravation of the condition, which is positive in psoriasis. Okay, these are the things. Now, by this analysis, now what we did? We analyzed the etiology, we analyzed the Samprapti. Right? We analyzed the etiology and Samprapti. इससे हमें क्या मिल रहा है ट्रीटमेंट करने के लिए, वो हम देखते हैं. इससे हमें 5 ऐसे चीजें मिल रहे हैं जिसके ऊपर हमें ट्रीटमेंट प्लान करना है. Okay, the first one is increased epidermal turnover. Second one is autoimmunity and recurrence. Third one is it is psychosomatic disease. Modern knowledge से आ रहा है. Okay, Koebner phenomenon is there and there is current etiology. Now increased epidermal turnover, I consider it as due to pitta. Why? Because whatever paka has to occur in the body, we call it as paka conversion, is due to pitta. Like cell has to mature and grow early and die. This conversion is taking place because of pitta and it is controlled by vata. Okay, more vata, less kapha, it will become scaly. Less vata, more pitta and more kapha, it will become oozing and all. That is also conversion. Eczema and all, their oozing and all will be there. In psoriasis, vata is more, less kapha, and that is why scaling is there. Okay, more Prithvi Mahabhuta type, Prithvi Vayu Mahabhuta, less Jala Mahabhuta. More vata and more Jala and Prithvi and Agni, then it will become oozing and all. Right? Okay, so we need to address pitta. Now autoimmunity, I consider Crimigna Traveas as best for autoimmunity. I will explain why. And Clether, right? Recurrence of the disease. Kushta is a Clether Pradhan Roga. So that is why we are taking both modern knowledge, Ayurveda knowledge. Even in modern also, if you study, I just asked one of the dermatologists who is a friend of mine, like ichthyosis. Ichthyosis, that fish scale type of presentation will be there. You all know that. It's very dry, right? It's very dry. In such patients also, modern doctors prescribe isotretinoin. There is one drug, isotretinoin, usually used in treating acne vulgaris or acne. ये क्या करता है, एक्ने में जो फ्लूइड कंटेंट रहता है, whatever fluid content will be there, it soaks that, it destroys that, or it reduces that. So that is why there will be strictures and punctum formation, pit formation will be there in psoriasis acne. So it reduces it, so it completely dries up that fluid part. Now I asked, when ichthyosis patient is having so dry skin, why you people are using? He told me to go through the histopathology. Histopathologically, whether it is ichthyosis or psoriasis, even though dry presentations are there, the condition is caused due to increased extracellular fluid. That is what our science has said, Kleda. Right? Excessive Kleda. Because of that, Kleda is the dosha. Doshas, according to the dosha, presentation is changing. More vata, dry scaly, more pitta kapha, oozing and all. Right? But Kleda will be there. So that is why we need to consider Kleda for preventing recurrence. As long as Kleda is there, the disease is going to recur. As long as autoimmunity is there, disease is going to recur. So both we have to take. Autoimmunity and Kleda. Autoimmunity from modern, Kleda from Ayurveda. Then what happens? Planning the treatment becomes easy. So it is a psychosomatic disease, psoriasis. You all know most of the skin diseases have got psychological involvement. So that is why we need to work on increasing sattva. And best part in psoriasis, in dermatology, enhancing or addressing sattva is documentation. Like what photos I am showing here, before, after. Most of these are like old photos. Most of these are new ones. Recently, in a month or 2 months, I have prepared the PPT. More than 50 patients before treatment, after treatment photographs we have displayed in front of our OPD. And sometimes what happens, a very different type of patient comes at that time. I show in my laptop, you can see, this is the patient. It was very severe than yours. Got, completely free from that in just this much time. Then what happens? Even the patient's sattva is less, that boosts the sattva. Confidence will be there and patient starts trusting. So patient should trust the medicine. If patient is not trusting, it is said, even because of trust, Visha can also act as nectar. If we do not trust, if we doubt nectar also, Amrita will act as poison only. Or it will not act as Amrita. Right? So that faith is very important. So that we need to bring in patient means, in dermatology, we need to document. And there is Kobner phenomena. So this tells us that we should not do any local irritation. We should avoid local irritation and we should educate the patient not to irritate. See, this is very important. Like psoriasis patients particularly, what they think, if scaling has gone, even if the skin has become red, no problem. Scaling has gone means they feel very happy, my skin is very good. No, it's not like that. So sometimes what happens, while taking bath, they rub and remove that, and after bath also they rub with the towel. After a week, पहले जितना था ना, शायद 50% था, अभी डबल बन जाएगा. Single point lesion होता, अभी 10 point जितना lesions बन जाएंगे. So that we need to educate. This is what is Kobner phenomenon. So we need to educate the patient. In current etiology is Visha, so we need to use Vishagna drugs. Now we will see how we use these in patients. Okay. You can see 8-9, the patient, you can see erythematous scaly lesions are there, non-patient of psoriasis since 4 years, 59 years. So what I gave her, Gudichi Churna, Haritiki Churna, Shundi Churna. This is nothing but Amrutottar Kashaya, Nagar Amruta Haritiki. Prepared Kashaya is costly. चूर्ण दिए तो सस्ते में 1 महीने तक दे सकते हैं. एक कषाय बॉटल के जितना पैसा पड़ता है ना, 120 रुपीज और समथिंग इज देयर. 120 रुपीज के कषाय चूर्ण आप कषाय दिए तो आप 6 से 8 दिन आएगा. अगर उतने ही पैसे का आप कषाय चूर्ण दिए तो 1 महीने तक आएगा. Okay, so 60 ml that freshly prepared kashaya morning and evening on empty stomach. Mahasudeshana Ganapati 1 tablet twice daily after food. Nimbadi kashaya 15 ml twice daily after food with water. Mahasudeshana Ganapati, because the patient is not having motion, is not clear, Amrutottar kashaya will take care of that. Poor appetite is poor and tongue is coated. She is having disturbed sleep. External application Kutaja that criteria tinctoria oil, whichever oil you can take. Soria oil, Sora herb oil, 777 oil, Win Soria, so many are there. But ultimately ingredient is Ratia tinctoria, that is 3 Kutaja. This was given on 9/8. This is on 26/8. Now you can see the complaints have started to reduce. Now I continued with that same, but what happened here with Sudarshan Ganauti, I was not able to get the anticipated Dipanapachana. So poor appetite, tongue is still coated. So I went to Shardhana. Shardhana, why? Because Shardhana is Kushtagna also. In Kushta and Vata Vedi it is said, Sama Vata conditions we can use. So Kushtagna and Dipanapachana also. So Shardhana 1 tablet twice daily. And she was telling she's not getting taste to eat. So Draksharishta is very good. So instead of Nimbadi Kashaya, because you can see Pitta is reduced here comparatively. So I switched to Draksharishta. This is also Pitta, Dipanapachana, Rochana. It enhances the taste perception. So it was given, and Kutaj Thailos continued. This is 26/8. 39. You can see more than 50% reduction is there. More than 50% reduction is there. Now again I started with Patolakatrunadi. Right? I needed to do, this is a type of Nitya Virechana, repeated Shodhana. Repeated Shodhana doesn't mean that every repeated you have to use Shodhananga Snepana, Abhyanga Sweda, and then Virechana. Again give a gap of 1 week or 10 days, 15 days, a month. Again give. Not necessary. Even if you are doing Virechana daily, Nitya Virechana type, then also it's good. So Patolakatrunadi 15 ml thrice daily after food. After food I give. Kalipet mein diye to old age patient 59. Sometimes Patolakatrunadi also follows pain. So after food. Okay, Dushi Vishari. तो मेडिसिन बिलवादी के सर्दर्न के छोड़ के हमने दीपनपाचन के कॉन्सेंट्रेट किया था. नाउ वी स्टार्टेड स्विचिंग टू करंट etiology, दूषी विषय. Okay, this whatever pitta we are treating for increased epidermal turnover, which is gradually reducing. So we have started with etiology also, दूषी विषय. Kutaj Thailos continued. 39. This is 16/10. Now you can see further reduction. Now again, what happened here? Hepatitis reduced. So again, I switched back to Amrutottar Kashaya, Nimbadi Kashaya, Dushi Vishari, and Kutaj Thailos. Sudarshan Ganauti था, उसके जगह पे दूषी विषय डाल दी. 30/10. Patient is having some 6 visits. Again, here what happened now? Though you can see all the scaly lesions are completely gone. But what happened here? Patient complained of small reddish puricas on both legs associated with itching and dryness. Psoriatic lesions are markedly reduced. So ये psoriatic lesions नहीं थे, छोटे-छोटे लाल जो puricas जो रहता है itching था. So I told there will be Koebner phenomena. वो itching ज़्यादा करने लगे तो psoriasis से फिर से आने की चांस रहते. तो इसलिए मैंने सोचा चलो प्रॉब्लम नहीं है, not to neglect and let us give for pitta kapha only. So I gave again for that only. Patolakatrunadi उसके लिए और दूषी विषारी क्या बोलते हैं उसको खंडू like that. And nalpam रहते. Now scaling has reduced. We have to changed that Kutaja to nalpam. This is 6th visit. 5/11. Now you can see only discoloration is there. So Patolakatrunadi continued. Occasional itching is there. Dushi Vishari and Kutaj Thailos. You can see 7th visit. Haridra Kanda, slight itching is there evening time. Haridra Kanda, Mahasudarshan Ganauti, poor appetite, tongue is coated, not as it was in the previous. Now scaling is reduced, Varna is needed. So oil is changed to Manjishta. Okay. 8th visit, 1/1/2023. Okay, now what has happened now? We treated increased epidermal turnover. We treated for Koebner phenomena, preventing Koebner phenomena. Condition has reduced, means Sattva was also treated. Now it has gone. We are not sure whether Kleda is reduced or immunity is reduced. So we need to treat for that. So for that, Vidanga Richurna, Vidanga Amalaki Musta Trifla, I told you like that. It is simultaneously clear, Kushtag. So I gave this 1 teaspoon morning on empty stomach. Dushi Vishari Vishakna, we continue. 1 tablet at night after food with honey. And Manjishta Thailos continued. This was on 1/1/2023. So 1/1/22. After that, patient has come in 6th month. She was perfectly all right. I usually here what I do. Let me tell you. Psoriasis patients. When we reach this stage, I give this Vidangadia Primigna as Kledhara. Those I give. So at this stage, what I do, I give medicine for 1 month. Oil will be continued. Oral medicine will be given for 1 month. Then I ask the patient to come after a gap of 3 or 4 months. Matlab, now January, full month, she will take the medicine. February, March, April, and May. She will not be having any medicine. She has to come in the month of May or in the last week of the April. But what happened? She came in the month of June, 5th month, I think. She was perfectly all right. Now she will come in November, another 5 months gap. Again, in June when she came, I have given her same Vidangadi Chu and Manjista Tail, I think, I'm not sure. Dushi Vishari also I'm not good. Right? This is how we need to work for preventing the recurrence. You can see the difference. Am I audible? Just want to clarify.
Yes, sir. Yes.
Okay. Thank you. You can see the before and after. Though we have taken like 9 visits are there, but span is 4 months only, 4-5 months. And I'm very fortunate. Many times in my lectures, people say, "Sir, how you get the follow? Give results, patients will come to you." Sometimes, I call the patients also. If patient has missed the follow, I call them for documentation. Like if I'm going for a presentation and I need new patient, so follow-up का time बाद में है, patient को आना नहीं हो रहा है, तो I want a little bit ask whether what is the condition. तो phone किए तो sometimes patients come just for giving me a photograph of the lesion, or if they are not possible for them, it's not feasible, they get the photos and they send the photos on WhatsApp. Okay, so you can see these she had not shown in the beginning. She had lesions on the trunk also. In between she showed that. This is another psoriasis, same line of treatment, short span of time. Same line of treatment because severity is not that here. Okay, this is on 11/9, first visit. Whole body he is having. Okay, he is having this for 78 years. Okay, Potolakatroinadi, Guduchadi, Pitta Kafara, it is Rechana, it's not so Rechana. Dushi Vishari, put it there. It was given on 11/9. 10/4, you can see the complaints are comparatively reduced. Now, scaling has reduced. You can see dry lesions are there, scaling is not there. Scaling is not at all there. Right? The first wall that increased epidermal turnover is almost achieved in first visit only. Right? Second level, autoimmunity clear. That is targeted here. Now, Arigordhani Kushtagna Dipalpachana, for that, Ayaskriti I added. Ayaskriti contains Asanadigalam. Asanadi is Kushtagna, Pramehagna, Kledahara. Right? And it comes with Loha, or Mandaloha, something like that. That is also Lekana. Kushtagna also. Kushtagna, Vataraktahara, like that. So, now this was added to that second autoimmunity and increased Kleda. Dushi Vishari, anyhow, we have to continue. Unavoidable Visha exposure will be there. That is continued and Kutasteros continue. 4-10. Third visit, 15-11. Now, almost scaling has gone. Now, Kleda we treated. Autoimmunity we are treating now. Vidangadi Churna. Vishakna is continued. Kutasteros is continued. 15-11. This is fourth visit, 11-12. Completely gone. 11-12, completely gone. You can see 11, where is my cursor? 11-9, 11-12, 10, 11, 12, 3 months. For psoriasis, 3 months is a really short span of time. You can see the result. So 11-12, again I gave Vidangadi Churna, Dushi Vishari, Manjista. I told you how I give. So in December, I told him, take this and come in March or April. He came in July. But with few new lesions. Because the gap is there. 6 months gap has taken place. In December or middle of the January, he stopped the medicines. January, February, March, April, May, June. 5 and 6th month. 6th month he came without medicine. And his diet, everything is continuously there. So now he came with new lesions. And I asked him to come again. Yesterday or last week he came with same type of pattern. And I have suggested him to get admitted for Virechana. At least if we give one Virechana, he'll be perfectly alright. Next, I think we can say at least we can give medicine like Udangali only I give later to prevent recurrence. I ask the patient come after 6 months. For each psoriasis patient, I do like that. Sometimes what happens is even patient is not having any clinical presentation also. I ask the patient to come in the month or just a month before the period where you usually get. मतलब पहले उनको उस सीजन में उस महीने में आता था, एग्रीवेट होता था सोरियासिस, उसके पहले 15 दिन पहले 1 महीने पहले आने के लिए बोलता हूँ। उनके पास अगर स्किन लीजन्स नहीं है तो भी उस टाइम पे बुला के मैं फिर ये दूषी शग्ना या क्लेदहरा या विडंगादी चून दिस टाइप आई क्यू, so that year will be skipped. So like this I do for 3 months at least. Okay, whenever in all the patients whoever I have done these steps, all these steps for 3 years, those patients are free from psoriasis for 8 years, 9 years, 10 years. Okay, like that. So this is what happens when we treat the patient with all these, what you can call, planning or understanding. It's not difficult. What we are using, we are just applying common sense. No any intelligence in that. We are just using common sense, right? Patient education, right? This is a scalp psoriasis patient, right? Patient came with this type of presentation. I gave him on first visit. In short, I am telling, we are running. So first visit, here it is. Himbari Kashaya, 15 ml twice daily after empty stomach. Ayurveda in between food, 2 tablets. Dushi share after food, potentially extra application. Second visit, the severity reduced. Vata was more. So Google Tikta Grita capsule, empty stomach. Ayaskriti means Kleda we are treating simultaneously. Dushta Kleda. Google क्यों दिए? Grita क्यों दिए? फिर Kleda है तो Dushta Kleda and good Kleda is there. Okay, when we give Google Tikta Gritas, they will not accumulate Kleda because Google will not allow accumulation of Kleda, but Grita will do its remaining work without accumulating the Kleda. So Ayaskriti is given, even if the Google of the Grita fails to avoid Kleda accumulation, it will take care, and simultaneously whatever excess Dushta Kleda is there, that it will correct. So for that, Dushi Sharon could is corrected. Now what happened when he came on this second visit? He had very nice scalp. First visit में ऐसा था, ये पूरा चला गया था, but only thing is he had grown hair, बाल आ गए थे. So मैंने इधर फोटो इसलिए नहीं डाला. So मैंने ऐसे बोलते बोलते बोला कि अगर आज भी आपके स्काल्प पहले जैसा होता तो I would have got very good feature for documentation. No, to favor me what happened? Patient took shave. He went to the hospital barber and he got his scalp shaved. And in just 3 days, he developed this more than what he had on the first visit. This is nothing but coronal phenomenon. This is nothing but coronal phenomenon. So scalp psoriasis patient, I tell them not to comb also. Comb करते हैं तो भी वो ऊपर से करो. No, वो तो वो ऐसा रोल करने वाला रहता ना, उससे रोल करो आप hair. So combing also enhances. So here the patient got increased. Then we had to give him Virechana. We admitted the patient. Right? We admitted the patient and we did Virechana, and he is perfectly all right. Okay, but that one of the things that we need to keep in mind, that coronal phenomenon. Unfortunately, he wanted to help me and he developed this. Okay, this is the outcome after 4th visit, मतलब Virechana के बाद में. So second visit में क्या हुआ, इससे ज्यादा बाल थे तो वो कुछ भी दिख नहीं रहा, तो मैंने इसको बोला इस बार सेविंग वगैरह नहीं करना है, ऐसे ही आओ. So this is what the outcome. Okay. Now before 4 months, after 4 months. Now dosha assessment. I was telling about dosha assessment, why it is important. Now you can see this is a psoriasis patient. This will explain us both the dosha assessment and Snepana, right? Shamana Sneha. You can see for same one I have zoomed it here just to help us understand dosha assessment. Okay, this one we will see now here. It is Vata Kapha. Now what are the Vata Lakshanas? Dry, Ruksha, Khara. Khara Paryanta, rough margins are there. Okay, Khara Paryanta. Lesions are thin. Thanu Udrukta Bahistanu means thin scaling and thin lesions. They are not elevated. Macular type, not so papules, right? Flake जैसा भी नहीं रहता, छोटे thin रहते. Macule भी नहीं रहते, थोड़ा उभरा हुआ, but thin. Kapha Lakshana, well defined. Mandala, well defined. Slow in spreading. So Vata Kapha dominant. Kushta, but psoriasis. Vata Kapha dominant psoriasis. This is what is interpretation of Ayurveda into contemporary disease. Vata Kapha dominant psoriasis. We consider it as Sigma Kushta. Okay. Now Pitta is coppery. Right? What I gave him, only Shamana Sneha. See, Ayurveda Dipana Pachana, Tikta Kagrita, 10 ml morning on empty stomach. with warm water. Nimbali Kashaya 15 ml twice daily after food. Dushi Vishari 2 tablets twice daily after food with honey. Nalpamrita tail for external application. And then the result. 2 months treatment. This is the outcome. 2 months treatment. Okay. Another example. Hardness is dominant here. Hardness is more. Right? कल्याण करता वहां पे क्या था पित्त डोमिनेंट वात जैसा था ना पित्त और धनु था वात डोमिनेंट ज्यादा था सो कफ उतना ज्यादा नहीं था यहाँ पे कफ ज्यादा है राइट घन कफ वात डोमिनेंट राइट सो कल्याण करता कफ वात है आरोग्यवर्धिनी दूषी विषारी गुलिका एंड एलाइथेन ही हैड सम psychological issue also so for that kalyan karta is good for that also this was given you can see we can see after one prescription first he completed the first prescription. This was his presentation. Unfortunately, he was not able to continue the treatment because here what happened, he came here after he came with this condition. I prescribed him some medicines. Somebody in his home got amazed. So because of that, he got stressed and he came back and I'm not able to continue the medicine right now because my mind status. So he said like that, we just, there is a policy of replacement. Like, प्रिस्क्रिप्शन जो भी बिल रहता है उसके ऊपर हम कंसल्टेंट साइन किए तो वो वापस हॉस्पिटल में चले जाते हैं अगर अनयूज्ड है तो उनके पैसे वापस दे देते इट वाज टर्मिनेटेड बट यू कैन सी इन सिंगल प्रिस्क्रिप्शन दिस कंडीशन वाज कन्वर्टेड टू दिस बिकॉज ऑफ growth if you give only kashaya it will not happen okay now you can see dosha assessment pathology whitish lesion on the wrist since 5 months or more associated with no itching no burning sensation okay इसमें कुछ नहीं Patient developed whitish lesion on the wrist in the shape of wristwatch belt, diagnosed as wristwatch-induced allergic leukoderm, or we can call it as chemical leukoderm. Chemical leukoderm is a little bit easy to treat. When I show you the result, don't get इतना भी हम भी कर सकते हैं इतना आसान है leukoderma नहीं ये श्वित्रा के अंदर ही आता है but all leukoderma are not so easy to treat, but chemical leukoderma are easy. This is a contact or chemical leukoderma. You can get a result in very short span of time. Other also you can treat, but takes time. Patience of the patient, patience of the doctor. Both is needed there. Okay. So now diagnosis क्या है आभरणिंशा. हेतु के हिसाब से दोष है. What is that? Etiology आभरणिंशा, right? What is this? Wristwatch is आभरण. We can say आभरणिंशा. Wristwatch induced leukoderm, right? So what is कार्य here? What is कार्य? इसमें I think comments option नहीं है, मुझे भी नहीं दिखते. रहने दो. कार्य is क्षेत्र वात प्रधान दोष वो दोष का छोड़ो वो मुझे भी समझ में नहीं आता क्षेत्र में दोष असेसमेंट कैसे करते हैं. Okay, कार्य is क्षेत्र. Modern as per the modern it is contact leukoderma. कार्य क्या है? आभरणिंशा. Etiological diagnosis that is metal allergy. Right? So, in text, text to present context we have to consider. See, text में, for example, this is the presentation of Padaka. Text में Padaka जब पढ़ते हैं ना पूरा पीड़िका and all, आभरणिंशा and all same. Padaka आभरणिंशा और same चिकित्सा it is said. So they all have this type of presentation, pitta dominant presentations, because in olden time such type of poisons were used. These are the presentations. But contemporary, we need to understand what type of presentation is there. Based on that. टेक्स्ट से हमें प्रिंसिपल लेना है सेम लेपा सेम दवा नहीं देना है प्रिंसिपल लेना है उसमें प्रिंसिपल क्या है विषग्न है और दोषग्न है उस टाइम पे विषग्न के लिए विषग्न जो देते हम वही विषग्न देंगे दैट विषग्न ओनली वी यूज बट व्हाट दोषग्न दे हैव गिवन एट दैट टाइम डोंट ट्राई देम एग्जैक्टली बिकॉज़ प्रेजेंट डे कंडीशन ऐसा नहीं है तो दोषग्न हैज टू चेंज राइट दैट इज व्हाट वी नीड टू डू सो आभरण विषय में क्या है उसमें कंडूक पीड़िका वगैरह आते हैं इसमें नहीं है अभी सो दोषा डिसीज स्पेसिफिक इट इज मेडिसिन सिलेक्शन कैसे करना है डिसीज करना है हमें कार्य क्षेत्र है क्षेत्र लेना है कारण क्या है विषय है विषय लेना ओके सो व्हाट आई गिव हिम असनादि कषाय 15 ml thrice daily after food असनादि गण शोधनादि गण द्रव्य संग्रह अष्टांग दूषी विषारी 2 tablets twice daily after food with honey nalpamrita tail for explanation 40th day you can see the outcome. This is on 40th day of the treatment. Medicine is Asanadi Kashaya, Dushi Vishari, Nalpamrita. So what was given? This is specific Asanadi Kashaya. Asanadi Shvitragna. Plain Asana also you can use. Nalpamradi is panchavalkala. It helps for bringing hypopigmentation to normal pigmentation. मतलब whitish to normal skin color लाने के लिए नालपामरादी तेल. पंचवल्कल युक्त oils, extra applications help. Vishagna, Dushi Vishari, we get Vishagna. So that is the result. Okay, so overall, what you understood is we need to have a kind of mental attitude to study Ayurveda, to change our approach. This is one of the quote, I think you all can see this one. This is from Chanakya Nidhi. What it says, Vyalashrayapi, Vifalapi, Sakantakapi, Vakrapi, Pankilabhavapi, Durasadapi, Gandena Bandurasi Ketaki, Sarvajantor. Oh, I forgot. Typing mistake is there. Gandena Bandurasi Ketaki, Sarvajantor is there here. Evam hi eko gunaha kalu nihanti samasta dosham. What he says, Ketaki all know, Kevda बोलते हैं ना. Okay, केतकी क्या है? Vyalashra, it gives shelter to snakes. Vifala, fruits no one eat, edible नहीं है. सकंटका, इसका जो पार्ट रूट से बाहर होता है ना, जमीन से बाहर, वहां से लेके टिप ऑफ ईच एंड एवरी लीफ एंड इवन पेटल, दैट लीफ, फ्लावर पेटल, एवरीथिंग इज थॉर्नी. वक्रापी, ग्रोज वेरी अगली. पंकिलभवापी, किचन में रहता है हमेशा. दुरासदापी, नॉट इजीली एक्सेसिबल. With all these demerits, Gandena Bandurasi Ketaki Sarvajantor, because of its aroma, because of its fragrance, Bandurasi means attracts. It attracts Sarvajantor, including Valor, snakes and all. So that is what he says. Evam hi, similarly, evam hi, eko gunaha kalu nihanti samasta doshan. Whenever kalu comes, 100%. Sure. Whenever acharyas have to tell something 100%, they use khalu. So, eko gunaha khalu nihanti samasta doshan. So sometimes what happens now, we keep on blaming the common. मेरे last RAV के लेक्चर में बोल रहा था. Common complaints क्या है? अगर वालों का पेशेंट्स कम आते हैं, हमें पेशेंट एक्सपोजर नहीं है, जो मेडिसिन से कम दवा है, दूसरी विषारी बिलवा दी दशंग इतने ही है. अगरदास कॉलेज में ये क्या सपोर्ट नहीं मिलता. We keep on complaining, not only Agada, everywhere, even interns only. Yesterday I was talking to some of the students. The complaints like some of the hospitals, they say, हमारे पास patients कम है हमारे hospital में. And when we ask the patient, you go and ask the students who are working in government hospital, interns, उनको पूछो कैसा है exposure? क्या सर रोज hundreds of patient कम OPD को आते, patient को concentrate करने ही नहीं होता. मतलब attitude is same both. सीखना नहीं है, वो एटीट्यूड हमें हटाना है कि क्वांटिटी इज नॉट इम्पोर्टेंट, क्वालिटी इज वेरी इंपॉर्टेंट. आई थिंक इन ईच एंड एवरी आयुर्वेदा कॉलेज इन इंडिया, इफ नॉट ऑल, एटलीस्ट मस्कुलोस्केलेटल पेशेंट्स विल 100% come. 100% come. Even if one student, one person can completely follow 10 Sandhigata Vata patient, just Sandhigata Vata patient, 10 full first visit to each and every visit till the treatment is stopped, saying that complaints are reduced or patient is free from the complaints. 10 patients देखे तो बस है. That student, that person can become Sandhigata Vata specialist. This is 100%. But what happens now? Our attitude is like that. We never think of that. So that we need to change. Even if with this presentation, if I am able to bring some change in your attitude, I'm not telling you all. Like sometimes you can tell your students, if at all you are in teaching, and if at all sometimes you also need motivation, but don't take that I'm very big and telling like that. But I'm telling, very sorry, don't feel bad. Okay, who will win this race? Actually, in this, the strongest is lion, weakest is the deer. फिर भी इसमें deer जीतता है. क्यों? Because the deer is running for life and the lion is running for food. So ये हमें डिसाइड करना है, हम आयुर्वेद में क्यों आए हैं? आने के लिए, डिग्री के लिए, सर्टिफिकेट के लिए, या जीने के लिए? So that is what is going to tell, right? Strike rate of lion is 50%, something like that. All the attacks are not successful. क्यों? क्योंकि ये खाने के लिए, ये नहीं मिले तो दूसरा मिलेगा, ऐसा है. लेकिन वो हिरण के लिए नहीं है ना, उसके पास एक ही जिंदगी है. सो हमारे पास भी वैसा ही है, एक ही है, उसको फ्रूटफुल करना है, उसके लिए मेहनत करना है. ओके, सो रन फॉर द लाइफ, नॉट फॉर द फूड. So this whatever journey I have done, no, this dermatology in this journey, अभी यहाँ से start किया मैंने, अभी यहाँ पे समझो तो if at all I have achieved something in Ayurveda dermatology, it took 18 years of consistent hard work and patience. It took consistent hard work and patience, right? ये सभी 2 घंटे में बताने के लिए नहीं होता. मैं क्यों बोल रहा हूँ, क्योंकि I have some offers for you. 2 घंटे में ये सभी पॉसिबल नहीं है. या अभी से आप भी कर सकते हो, फ्रॉम यहाँ से 8-10 साल मेहनत करके आप भी यहाँ पहुंच सकते हैं. ओके, अदरवाइज इफ यू डोंट वांट, you can accomplish, you can reach here in just span of 5-6 months. In just span of 5-6 months. Okay, because I have something to offer. I have some courses. This is my 30 hours online course on psoriasis management mastery, where you will study effective diagnosis, Ayurveda diagnosis, dosha assessment, OPD-based Shodhana, IPD-based Shodhana, OPD-based Shamana, prevention of recurrence, everything. 30 hours pre-recorded videos will be there. Everything is based on patients. Everything is based on patients. And you get lifetime access. And anytime, anywhere, you can watch as many times as you want. And simple English mein. Or there will be, whenever you will be watching the videos, you can drop your questions in the comments. वो मुझे मिलते हैं, and every like 10 day or something like that we conduct live session. Periodically we conduct live session depending on the questions. So live sessions में वो questions clear करते हैं. आपको questions का video भी मिलेगा. आप live भी attend कर सकते हैं, नहीं तो वो भी attend कर सकते हैं. इसका है actually 15,000 है, but offer price is 6,600. You can visit our website और इस QR code को भी scan करके join कर सकते हैं. और है dermatological manifestations of Visha. This is present day, like contact dermatitis, allergic manifestations, occupational skin disease, all those things. Same pattern, pre-recorded videos. Again, case based only. Everything is based on cases. This is of 20 hours. इसका 7,000 plus है, but offer price is 3,500. But together, if you this is for undergraduates, same, but थोड़ा component कम रहता है, way of understanding, explanation कम रहता है, and UG के लिए suitable हो ऐसा. Same contact dermatological manifestations of Visha, 2,000 rupees है इसका. अगर आप practitioner हो, PG हो, final year हो, intern हो, या practice कर रहे हो, करना चाहते हो, dermatology में explore करना चाहते हो, I recommend this one. 50 hours complete, 50 hours psoriasis management mastery and dermatological manifestations of Visha. इसका कुछ 11,000 कुछ तो होता है, but you can get access to both courses lifetime at just 7,500 rupees. You can scan the QR code or you can call any of these numbers, or you can call me, or you can visit our website www.ayurvedicskills.com. Okay, 100% you will get benefited. Like many students have joined. Some of those who are already practicing, they have made almost 10 times, 15 times the investment in some 7-8 months. Okay, so to conclude, understanding Kushta Nidana Samprapti in terms of contemporary disease, present day disease, is the base of effective practice of Ayurveda dermatology. It is not only for Ayurveda dermatology. As I explained Ayurveda dermatology, I am telling, but it is base for every disease. If you want to treat any disease in the line of Ayurveda, contemporary disease, avoiding exposure to present day chemicals, vishas and all, it's highly impossible. It's highly unavoidable. Even WHO says it's unavoidable. So while treating disease, you need to treat for the karana also. The present day karana is Visha. So we need to treat with Vishagna along with Doshagna, Shtagna and all. Okay. So thank you all. Hope I was able to give something additional to whatever you know. And somewhere if I have been somewhere harsh, little bit harsh, please, sorry, excuse me. And I'm very grateful to NASYA Organization for giving me an opportunity to come in front of you and share my views in front of all of you. Thank you very much. Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
I am very much grateful from the NASYA Parivar that this type of lecture you have delivered and enlightened us on the topic dermatology. Yeah. If anyone have the question or any queries, please text in the message box. Sir, one query is there. What is the appropriate stage to start local application of medicated vials? A question from Abhideep ji. Am I audible, sir? Actually, you are muted, sir. Please unmute the microphone, sir. Mahesh, sir.
Yes, sir. Yes, sir. Sorry. Dryness was there. I had a little jaggery. Just a minute, sir. I have water.
Okay, okay. Sir. No problem.
Yeah. The question is, what is the appropriate stage to start oil application? Local applications of medicated oils. It's not the stage actually. It is what you want to use. For example, if you are using such oils which are going to do kleda harana, like it is reducing kleda. For example, nalpamraditele. Nalpamraditele even you can use in a condition where oozing is there. No problem, you can use. But only thing is, you should be doing some seka and applying. But most often, it is always good to reduce some amount of seka. So you do seka and reduce some amount of kleda. Okay, watery oozing and all is there, continuous oozing. At that moment, it's not right to apply oil. But once the complete weeping, continuous watery oozing is reduced, at that time you can give oils like nalpamraditele. Even if you see marichaditele, most often people use marichaditele in very dry conditions. But practically marichaditele indication is what is the vicharchika hai. Kandu pidaka shava bahusrava vicharchika. But in our mind we have the idea that oils must be used in dry condition. No, it's not like that. Oils are not having samskarasya anuvartana guna. Oils forget its own qualities and attain whatever you are treating with. Like nalpamradi is completely ruksha, shita, khara, not khara maybe, ruksha, shita, laghu, and it's not snigdha at all. So even in oozing conditions also you can use. It is completely dependent on what is the composition of oil. Depending on that you can use.
Thank you, sir. If anyone have the queries, please unmute the mic and you directly put the question. Abhideep, yes, you have raised the hand. Please unmute and.
Sir, namaste, sir. Sir, as you said earlier. Sir, as you said earlier, that today's all the foods are made from fertilizers and pesticides are used in production of food materials. So, in today's era, what are the alternatives for that, and what can the normal people can do for that?
You are asking alternatives for pesticide fertilizers, madam, or?
No, not for fertilizers and pesticides.
Yeah.
As you said that all the food materials, mostly vegetables and fruits, are made from basically the production of them. Fertilizers are mostly used in today's era. So what can the normal people can do for that? Because in the market, everything available is for that.
Not normally everybody. No one can do anything. Even if we claim that we are eating organic, in India, if it is said like present day land, it has to be considered as completely organic, means it should be barren for at least 10 years. मतलब इतना ऑलरेडी है उसमें सॉइल में, हम जितना भी ऑर्गेनिक बोल के कल्टिवेट किए तो भी उसमें ये केमिकल्स आने ही वाले. सो ओनली थिंग इज सर्वम अन्यत् परित्यज्य आरोग्यम, something it is in Acharya Charaka somewhere says. So like that we need to work on ourselves, like eating good amount of ghee, as I was telling, good amount of ghee, but people think eating ghee increases weight and all. It's wrong actually. It will never. Ghrita is very good. Around at least 10 ml a day, Ghrita can be taken. Dushi Vishari is very good. Like some people who are having such occupation are unavoidably getting exposed. So every month, 5 days, 10 days, they can take Dushi Vishari, then give a gap of a month and take medicine. Like that, such things. We need to make efforts to keep our body every time or regularly getting detoxified. We should go for periodic Shodhana. That also is one of the best options. Like that only we can do. We should maintain proper like exercise and all. So that will be the good thing. And avoid where direct exposures are there. Where we know that knowingly we are getting exposed, such things can be avoided. Otherwise, we need to enhance our immunity so that we can overcome to some extent the hazardous effects of these present day low potent poisons.
Thank you, sir.
Thank you.
Sir, one query is from Surendra. What is the concept to use Krimiogn drug in case of autoimmunity?
I forgot to explain that. Okay. Sir, actually what I treat, immunity is nothing but one type of Krimignatva. Krimignatva is one of the part of immunity. That is what I feel. Krimignatva is naturally there in our body. Like we cannot add any karma which is not naturally there in our body already. जो नहीं है वो बाहर से हम कभी भी नहीं डाल सकते. जो भी हम drugs, whatever medicines and all we give them to correct existing karma, enhance existing karma और increase existing karma. उतना ही करने के लिए देते हैं. नया कर्मा कुछ भी नहीं डाल सकते, including वमन. Naturally वमन is there, छाती is there, automatically we vomit. जब वो नहीं हो रहा है उसको enhance करने के लिए दवा देते हैं. So Krimigna, I consider Krimignatva is there in our body. It is part and parcel of immunity. So when we give Krimigna drugs, at that time, that Krimigna drugs is going to work on Krimignatva of the body and they correct the Krimignatva. If it is reduced, they will increase. If it is hampered, they will correct. Like autoimmunity is one of the hampered Krimignatva of the body. So when we use Krimigna drugs, that gets corrected and we see the result. So इसको समझने के लिए स्टडीज वगैरह करने की जरूरत नहीं. For example, most of the antimicrobial in vitro studies of Vidanga, antimicrobial activity, they have shown negative, they have given negative results. Antimicrobial property दिखता ही नहीं उसमें hardly. क्यों? क्योंकि वो डायरेक्टली एंटीमाइक्रोबियल नहीं है. जैसे हमने कुछ एंटीबायोटिक लिया, पेट्री डिश में डाला, माइक्रोब्स मर गए, हमारे वैसे नहीं है. हमारे क्रिमिग्न ड्रग्स क्या करते हैं, वो शरीर में जाके क्रिमिग्नत्व को करेक्ट करते हैं. That क्रिमिग्नत्व acts on the microbes and kills the disease or whatever disease causing agent. So when we give Krimigna drugs, the altered Krimignatva, that what I consider as autoimmunity, that gets repaired and the disease will be cured. That's what is my way of understanding Krimignatva. I'm not, it's okay even if it do not go right with everyone, no problem. But I'm getting results, Pratyaksha Lakshana Phala. So I'm thinking it's autoimmune disease. I'm giving Krimignatva for correcting autoimmunity and disease getting cured. So means disease is getting cured means autoimmunity is getting corrected. So Krimigna drugs can be used in autoimmunity.
Thank you, sir.
Yes.
Actually, your concept is on Karya Karan Bhav.
Yes, sir.
We are practicing in Ayurveda in our OPD. We are doing Samprapti Vigatan Chikitsa. And then we see what is the Vikar Prakriti, Vikar Adhisthana and Vikar Samuthatva. Then we apply the this type of treatment like Nidan Parivarsan and Prakriti Vighat and Prakriti Asthapan. We are doing in our OPD. So this is the concept, little bit different from B side, because I am practicing through Samprapti Vigatan Chikitsa, and this concept is very interesting, that you are showing all the disease, all the dermatology disease according to Karya Karan Bhav, and what is the type of dosh and what is the line of treatment of that particular dose is very interesting and very interesting that you get the result very quickly. So this type of line of treatment and this type of motivation you give us today. Very thank you, sir, for your presentation and your knowledge sharing. And lastly, I want before the ending the session, if lastly I ask if anyone have the queries related to this presentation, then ask. Okay, sir. No anyone any queries? If there will be any queries or then any suggestion, I will share you, sir. And you no, yes, no one put the question. Thank you, sir, for giving the time and giving the opportunity to share your views among the us and this type of knowledge. निश्चित रूप से सभी हमारे जितने भी यंगस्ट है जो हमारे अभी जुड़े हुए हैं लगभग सभी यंगस्ट जुड़े हुए हैं और यंगस्टर्स के लिए ये बहुत ज़्यादा मोटिवेशन देने वाला है। और आपका जो सबसे जो ज़्यादा मुझे अच्छा लगा कि यू हैव डू द डॉक्यूमेंटेशन ऑफ ऑल द थिंग्स. दिस इज द नीड ऑफ आवर आयुर्वेद फैटर्निटी. सो very impressive, sir, your practice.
Thank you so much. Thank you.
और नस्या परिवार की ओर से मैं बहुत धन्यवाद ज्ञापित करता हूँ कि आप आज इस सेशन में आए, अपना बहुमूल्य समय हम लोग को दिए, इसके लिए बहुत धन्यवाद, सर. और आज के जो मुख्य अतिथि थे उन्होंने भी अपना बहुमूल्य समय दिया इस कार्यक्रम में. और सर महानिदेशक हैं आयुष विभाग बिहार सरकार में, उन्होंने आकर में ब्लेसिंग किया और इस कार्यक्रम में भाग लिया, उनका भी बहुत धन्यवाद. साथ ही साथ हमारे जो भी वॉलंटियर्स इस काम में लगे हुए जो अनवरत हमारे इस प्रोग्राम में लगते हैं, ऑनलाइन सारा टेक्निकल इश्यूज जो हैं वो वैद शुभेंदु है, जागृति है और इस टाइप से हमारे जो वॉलंटियर्स हैं उनका भी बहुत धन्यवाद और नस्या की पूरी टीम को धन्यवाद. साथ ही साथ आज जो इस डेलीगेट्स के रूप में जुड़े हुए हैं इस नस्या आयुर्वाणी में, उनका भी बहुत आभार और सभी का बहुत धन्यवाद. फिर हम अगले महीने एक नए टॉपिक के साथ, एक नए विद्वान और विशेषज्ञ प्रैक्टिशनर के साथ हम अगले महीने के 3rd शनिवार को फिर आपसे मिलेंगे. तो सभी का बहुत धन्यवाद. और विशेष रूप से लास्टली फिर सर डॉक्टर महेश सर, आपका बहुत
Thank you, sir. Thank you for giving me opportunity to be on your platform. Thank you. Thank you, everyone.
Thank you, sir. Thanks to all. Namaste.